So usually we receive referral from MPs, grassroots leaders, community clubs, CDC, all the government agency, police, town council, religious leaders, mental health first aiders, which we have educated, mental health advocates, and we assess what are their needs. If let's say it's a financial issue that caused them to be depressed, we refer them back to MPs and grassroots leaders where they can approve ComCare fund to assist them. So maybe we advise them to talk to the hospital, MSW, medical social worker, if let's say they have concern about seeking help from the hospital. And if let's say it's a mental health issue, we refer them to the GPs, polyclinics, IMH and hospitals, or even private psychiatrists, giving them an alternative. Most of them decided to stop their treatment because they are not aware of the alternatives, the options available in Singapore. Then followed by rehabilitation. If let's say they said that, I have someone who is with mental health issue and I'm afraid, what will happen to this person when I'm at work, we will refer them to Singapore Association for Mental Health or Singapore Community Services for Rehabilitation. Then if let's say it's a social issue, we refer them to CDC or Family Service Center or another VWOs who can address the needs. Or family issues, we work closely with the family members, or sometimes we involve the religious leader who they respect a lot. The employment issues, we work closely with IMH Job Club and Work Care Agent, if let's say they need a job. So we do not duplicate their services, but we refer them accordingly. Then for introduction or community outreach program, we actually organize a lot of events. Like for example, when you conduct a talk, we don't just conduct a talk, mental health talk on psychosis or mental health talk on depression. Due to stigma, nobody is going to attend that talk. So if you look at this flyer over there, top right-hand corner, we have a signature talk that we work closely with Dr. Swapna's team. It's Friday the 13th, psychosis versus possession. Because most of the time when people have psychosis, they are talking to themselves, and members of public with limited knowledge, they thought that they are being possessed by evil spirit. So during this talk, we involve paranormal investigator to debate against our poor Dr. Swapna, our psychiatrist. So what is what? Oh, we have film festival. We screen a number of films, international films, and we don't just screen it for the sake of screening. We close it with a speech by a psychiatrist and a patient to clear the stigma. Then we also work closely with the grassroots leaders, religious leaders, teachers, school counselors on different events. And students, we engage them in mental health projects so that they can learn more about mental health issues. And we train them to be mental health ambassador. And we also introduce internship programs, providing an opportunity for them to learn more about mental health issues. So this is what we have been doing to promote all this knowledge. And we work closely with shopping mall. You'll wonder, what's wrong? Why are you involving shopping malls? No, it's a corporate responsibility. So yearly we work closely with Orchard Central, where there's a Ferrata wall. And a lot of people are doing walk or run to raise awareness. For silver ribbon, we do climbing. So we have this team here, hang on there for the patient. Hot challenge. It's a yearly event where we raise awareness, and we partner closely with media corps. We involve the artists or radio DJs to raise awareness. And we work with 6 shopping malls as well, Hougang Mall, Tiong Bahru Plaza, to organize some lucky draw deep. We realized that maybe during festive season, there's a high rate of people experiencing depression. So we try to do all this to raise awareness. So we customize our events according to the targeted audience. Yeah, and then we work closely with the religious group, and we provide some basic mental health training for religious leaders, because we understand that they are first contact with their members who might be exhibiting some signs and symptoms of mental health issue. And following that, of course, the most important will be our policy maker, because they are the ones who help to introduce some good policy and working on the budget for mental health. So these are the some of the ministers and MPs that we work closely with. And we provide public education. And during our public education, we involve mental health professional, consumers, there's another term for people with mental illness, and their caregivers. And we introduce not only local but overseas programs, and we customize our programs according to the targeted group through innovative means. And I always feel that everybody has a role to play when it comes to mental health promotion and advocacy. And thank you so much for your contribution. Thank you.